So a sports hernia is not a true hernia. It's the definition of a hernia is a defect in aponeurosis or connective tissue fiber that intra-abdominal contents can go through. With a sports hernia, it's different. The definition is unilateral groin pain, meaning one-sided groin pain, not on both. It could also be a pulled muscle or different things that cause that groin pain that's not an actual true hernia or a defect in the abdominal wall. Anybody can. High-performance athletes such as professional hockey players or football players, I would say it would be more common in people who aren't athletic and they go try to do a high-intensity sport. They're not stretched properly and then they push themselves to their maximal range of motion or limit. Pain in the groin on one side. It could be a sharp tearing pain, it could be a burning pain. Something that doesn't go away after a few days, but most of the time you could tell in a clinical exam. So if you go to see your doctor with groin pain and they don't feel a hernia, they might order certain tests like an MRI or a high-resolution ultrasound exam to see if they could find out exactly what's going on, and at that point they may decide to refer the patient to the specialist. You really just want to start with rest. You can use anti-inflammatory medications like NSAIDs, non-steroidal anti-inflammatory medications. A good example of that would be Motrin or ibuprofen. And you really just have to avoid that activity that likely caused the sports hernia in the first place. You have to avoid it until your symptoms go away. The recovery is usually 2 to 4 weeks before you're up and about and feeling relatively back to normal. Some patients are much quicker, the first few days. Some can take a little bit longer. An open hernia, I'm more cautious about returning back to activity. The recovery is usually 4 to 6 weeks.